Thanks to all of our panelists. We're going to move into the discussion, but we're going to kick off our discussion with some reactions from a panelist, Andrea Downing. She is a community data organizer, and she is also the president and co-founder of the Light Collective. So I believe Andrea's on.
Yep, I'm here. Can you hear me okay?
Hear you good, and you look good. Go for it.
Well, thank you, Deven, and thank you all. This has been an incredible panel. Kristen, Nancy, Jan, Khadija, and Kathy, I want to thank you for your expert perspective on these things. And I think I have about 10 minutes, so I was going to start with just a little bit of storytelling, because, you know, as a BRCA1 mutation carrier, I think it's important to ground all of these things in real world experience. And so, you know, my views as a patient advocate, or what I call a bractivist, which is an activist who carries a BRCA1 mutation, are really coming from the perspective of where the policy, ethics, and data sharing rubber meets the road for my community and my future and my family. So I wanted to begin with that. Before I go into some of these questions, and I know, Deven, you're going to be asking some questions as well. I wanted to share a little bit of background, you know, just thinking about where we are as a hereditary cancer community, or the BRCA community, in all of the places that my genome could have gone right and could have gone wrong. My future changed when I had a T and a G that somehow got switched on place 181 of my BRCA1 gene. And what that meant was 14 years ago, I learned I have a bug in my code. And that was an incredibly, you know, life-changing experience for me. We're talking about, you know, genomic privacy policy and how these bigger picture issues kind of trickle down to somebody like me and my community. And one of the things I've been reflecting on listening to these different panelists is, you know, for a number of people, including myself, particularly women who are affected by hereditary cancer and these mutations, we often fall through the medical cracks of the healthcare system, and we struggle, right? And when we struggle, we go to solutions or things outside of the system that don't really, you know, meet our needs. And what that looked like for me about 7 years ago was I found a support group of incredible people, cancer previvors and survivors, who also shared this identity that I had of struggling to navigate the healthcare system. My first foray into advocacy back when I began this path was with a case that was then in federal court that went to the Supreme Court on whether human genes can be patented. And that was Association of Molecular Pathology versus Myriad Genetics. And it grounded, I think, our community in understanding how, you know, there's this history of either, you know, diagnostic companies or technology platforms being able to benefit from our community's shared data, and how that might impact from a policy perspective or from a data sharing perspective, our access to care, our access to diagnostics, and the needs that we have. So I'm asking myself all of these questions also as an accidental, I guess we could say, security researcher and an accidental hacker. You know, fast forward into 2018, I started to learn about consumer data sharing outside of HIPAA-covered entities. And what I specifically mean by that is a lot of our communities go to social media for support. And I started doing some research. I had a little bit of background in APIs. And lo and behold, I had just enough information to be a little bit dangerous, finding and learning about how social media, particularly the data generated by our community on social media, can be used against us by employers, by healthcare providers, when we don't have the right protections and policies in place, or the right governance standards. So a lot of my questions are around that. You know, and I want to start with, you know, these questions around privacy. So Kathy gave a really good background and landscape of the place where we have direct right of access, re-identifiability, and some of the things around the common rule. Well, the second things leave a HIPAA covered entity. I guess the way we're looking at it right now is users don't have a lot of rights. So maybe I could start there and ask and kick it over to Deven. This is just kind of my reaction and thinking about these different topics. What do rights need to look like for users when something leaves a HIPAA covered entity? And when we think about fair representation of our rights, what does that look like for my community?
Do you want to have some other comments, Andrea, before we kick off into the questions and comments? Or I want to make sure you have your time to say what you want to say, because I think once we open the dialogue for discussion among all the panelists, I think at that point there'll be lots of discussion. But I just wanted to make sure you were.
Well, I'll tell you what. I will say one other thing, and then I do think we should open it up to the panel discussion and start with that question. That's the first question that I have. Okay. The other thing I'm thinking about is our data, is not an abstraction to us. When I think about this data that we're talking about in these different panels and topics, it represents generations of suffering for me, my family, and my community. And so, I would really love to also talk about and react to some of the topics around fair representation in governance and what that looks like. The questions I have around this are, how do we go beyond just visual representation of our community, not only in pictures, but through true partnership? And how do we go to enforceable rights where we're shaping some of these digital health apps and technologies from the ground up and doing so in a way that represents us as actual voting members beyond just, the photographs or beyond, I guess, me being an advocate and sharing my story. That's another big question that I have around governance, and I like to say no aggregation without representation. That's I think an important theme too. So with that, I will hand it over to you guys, Deven, and thank you for this incredible panel and a chance to be a part of this discussion.
Okay, great. Thanks, Andrea. I think all of the panelists should now be able to be visible. And I know my co-moderator, Brad, will help us deal with the questions. Andrea, you tossed one up. I think we can get started with one that you tossed out there around, what happens to data outside of the realm of HIPAA. I mean, we had some examples earlier today of some applications and tools that are used within, used by clinicians that are sort of part of the, covered by HIPAA for better or for worse. But then when you're talking about the tools that are used by patients and individuals, then it doesn't. And Kristen Rosati, who provided our legal expertise, we only gave you, a short amount of time to touch on all the legal issues. So I don't know if you want to answer this or,
Sure. Yeah, you bet. And I certainly welcome other thoughts too. I think Andrea and Deven have really hit on one of the primary problems with data sharing in the U.S. And that is that we have this patchwork of laws that presently leaves a lot of information that's very important to patients unprotected. So I think we need a couple of new laws in the United States. We need a good federal data privacy law that doesn't apply just to HIPAA covered entities. Of course, there'll be lots of debate around what that law should say, but I think we need to have a better system of data protection that really protects people for real, who gives them representation in the use of their data. And we'll get to individual consent issues are slightly different, and I do want to talk about that before we leave the discussion today. but individuals should have at least representation and perhaps a trust model in use of their data. And then we need better discrimination laws to prevent people from real discrimination that they're experiencing in genetics. Right now, the Genetic Information Non-Discrimination Act protects against discrimination just in large employers and health plans, but it leaves life insurance companies and disability insurance companies and small employers and a whole host of other actors to discriminate unless their state laws protect individuals, which again is a patchwork as it usually is. So I think we need a better federal data privacy law. We need a better federal anti-discrimination law that protects individuals.
Can I ask a follow-up question to that? So one of the things I have seen, I guess I heard a theme across a lot of the talks about needing this federal privacy legislation, but the last time I was in public, I was literally on the Hill, like asking, when are we going to have this type of legislation? Like, when will we have a comprehensive privacy law? And coming, out of discussions with the FTC, where the one rule that they had authority to enforce, the PHR breach notification rule, didn't get enforced when it kind of came to health privacy in that $5 billion settlement with Facebook. So I guess I got to ask, like, going back to where the rubber meets the road, if we have all these gaps outside of a HIPAA covered entity, is it realistic for us to say, like, this policies, these needs for policies are coming, and they're coming right now? Like, I actually think this is like a 5-year problem. I don't see this coming down the pipes next year, and yet all of these digital health apps are proliferating. So what do we do?
Right. Just a real brief thought, and then I'd like to turn it over to others for input on this one. My understanding, there is actually bipartisan support for a federal data privacy law with a couple of real sticking points between the Dems and the Republicans. But it's possible that we'll have something soon. And I think one of the things that's driving that is there's a lot of support among the big tech companies for a federal data privacy law so that they can have predictability across states. I think one of the things we'd have to do is just have a federal law, not have the leftover patchwork of state privacy laws, which is a huge problem for companies that operate across states. And then I think the California Consumer Privacy Act is really driving things forward because it applies to a whole lot of businesses outside of California. So a lot of businesses are taking that plunge into the deep end of the data privacy pool in California now. And I think that's really going to drive some real effort on the federal level.
Other panelists on this one? I always have hope, personally. Go ahead, Jan. Yeah.
So although I'm not an expert on U.S. privacy laws, I do work a lot on data governance. And one of the things that I personally see as key is actually, I see this a little bit as a puzzle. And laws are one part of the puzzle, but you cannot just think about the law, because then, you won't have this complete protection, this complete puzzle in place that's going to really protect you. So I think we need also to think about administrative guidelines, standards of practice that are much more up to date, especially when you're talking about these digital technology, because the scientific progress is so quick that you need to be able to change things almost all the time, because at the same speed as you're thinking about solutions to prevent data breach, somebody else on the other side that is not always well-intentioned is finding new ways to breach into data set. So you have to be able to react quickly. And we talked about non-genetic discrimination policies. That's also part of this puzzle, because, you can try to be as comprehensive as possible in terms of laws and policies. And even at an international level, there's going to be cracks somewhere. So you also have to have the secondary solution in place where, yes, there's been a data breach, but you can also make sure that the people who have now the data cannot do everything they want with it because it's also illegal. So you have to be really comprehensive in the way you address these problems. And I think that's where you'll be the most efficient.
Yeah. Brad.
Yes. So I'm going to pull moderator rank for a moment and keep us moving along since we have a limited amount of time. But I'd like to continue us along these lines of discussion from the perspective of money, for lack of a better term, or at least remuneration to a certain degree. So one of the questions that was posed to the panel by Andrea Burundi-Kitts was, what are your thoughts on compensation for patients for their data when their data are being sold to commercial AI companies? And let me broaden that a little bit, because it's probably not just AI companies, and it's just companies in general. And so this is not about healthcare per se. This is about questions of, I guess you could say, to a certain degree, intellectual property. Somebody wants to take this one.
Do you want me to start to kick it off in a fairly controversial way?
Sure, Kristen, you can begin.
But again, others should jump in as well. Just I didn't see anybody else's take themselves off of mute. So, I think compensation of individuals for the use, particularly of de-identified data, is really a tricky issue because it ties in with being able to interact with those individuals. So it raises many of the same problems that getting individual consent for use of de-identified data pose. And there's three really substantial problems with getting consent from individuals for the use of de-identified data. One is that it, at least for use of that data for research purposes versus commercial purposes, if you require it for research purposes, you introduce a consent bias. So only particular types of individuals may be interested in having their data used for that purpose. The second problem is that consent and interacting with individuals is not always the best way to protect them. There's lots of research on the fact that consent, a lot of patients, particularly if their physicians or others of trust ask them to provide consent, they do, whether or not it's in their best interest to do so. And then there's huge expense associated with interacting with individuals. We may not be as concerned about that for the commercial use of data, but some of these kind of individual control issues are posed with the use of data to improve the healthcare system and for research as well. So I think we have to be really careful about assuming that the best way to protect individuals is to interact with them directly. And we need to think about moving again to more of a trust model where we bring financial benefits to a community and involve representatives of a community in governance and decision making, but maybe not make it a transaction for the individual. Because in my view, in the US, we're much too commercially transactional anyway. And I don't think we should introduce that approach into data sharing.
I saw Khadija.
Andrea, you were going to... Oh, yeah.
Khadija, would you like first, and then I'll go?
Well, I have to say, Kristen just really said what I was going to say quite nicely, which is, thinking about governance of data more on from a community standpoint, especially when we're thinking about particular communities, when thinking about marginalized communities where, an individual consent model may not even really be culturally relevant or really advance the specific needs. And if we're talking about health data, health needs of that community. So I would just agree and say thinking more along the lines of sort of a community model, a trust model, a data cooperative model is one that I would emphasize.
So I have a big smile on my face because I couldn't agree more. And I've over the last, I guess, year and a half have learned there are a lot of people thinking about this idea of like a civic trust or community trust model. And I think one of the things I'm struggling to understand is how to implement a model like that in a way that brings a community up the learning curve of understanding, like, for example, Jan, you have such a wealth of experience in data governance, right? And you're talking about like having a strategy for that that's like, flexible beyond just, national policy, right? So, in theory, this is really interesting, like this idea of a civic trust or a trust model where we have community representatives and the community is the beneficiary of any financial, I think, transactions that occur. Speaking from an advocate's perspective, I think fair representation does look like being part of those negotiations and asking, and equipping leaders in the community to understand what that looks like. And my question would be like, next is how, like, what advice would anybody have? Like, how does that happen? Because it hasn't, there are some small examples of that happening now, but not necessarily for our topic, for cancer genetic data sharing. Like, what would you guys say? What advice, what wisdom would you have on that?
Nancy?
Thanks. So I want to build on a few of these. And Andrea, I'm not exactly answering your very, very last question, but I guess I just want to throw out there that it might be worth thinking about benefit in ways that are more expansive than financial. And I really mean it to be a yes and, but it seems to me that one of the most powerful outcomes that can result from having participant engagement is starting to understand what, from participants' perspective, might be powerful about having this app, this database, this set of learning. And the more that can be incorporated into its purpose and what it does, even if it's an add-on from what the developer originally had in mind, it seems to me that will be really relevant. But often without those voices, that kind of specific need, it's not that it's ignored, it's that it just literally wasn't on someone's mind because the developer had a really particular purpose in mind. And then there are other purposes that could make such a huge difference. The one thought I have about your question, Andrea, and it is like sort of the, $10,000 question, and I'm not the great expert here, but I'm thinking of what Jan also said about things that go beyond laws. I have been wondering for a while whether there are ways to have different kinds of sort of seals of approval, different kinds of notices that exist. Someone would have to know to look for it, but something that starts to indicate that certain things are or aren't in place with different apps, with different kinds of technologies.
Interesting. Back to you, Deven.
So there was one other question in the queue that I think we have time to ask if we get there quickly, from Dr. Samuel, Cleo Samuel from UNC to Khadija, around racial bias in oncology app algorithms. How do you hold developers accountable when the algorithms used are not publicly available, and when equity-related accountability measures don't exist or are not enforced?
Yeah, that's a great question. And I think it actually really ties in very well to a lot of what we've been talking about the questions that Andrea has raised around accountability and governance, and particularly also around Jan's point to, there's pieces of the puzzle. That was a nice kind of framing that you put out earlier. And I agree, right? There are laws and something I know, Deven, you and I have talked about because of your past experiences, that there's laws, but there's also enforcement, and enforcement can be really, really, tricky. And there's all sorts of things that go into that, including capacity to do that enforcement. And so to Dr. Samuel's question around accountability for the app developers, it's a great question, and I think and it's a tricky one. But I will, and I've written a little bit about this in a publication that should be coming out in the Journal of the American Medical Informatics Association soon. But it addresses some of the points brought up earlier by Amy Abernathy about the FDA and this sort of developing governance around AI and machine learning. And it's sort of in this phase. And one of the things that I write about that I'll just kind of quickly address here that deals with accountability is that, right, and if we're thinking of this puzzle, there's laws, there's governance, and when sort of thinking about how to create kind of more of an ecosystem of accountability, if you will, one of the things that I mentioned for app developers that Amy Abernathy talked about earlier is that, it's really important to, as part of this certification process, to sort of understand, is this company itself, does it have good practices? And there are some really good ways that good practices are outlined in the current policy. But I also say, and what I suggest is that, companies should also demonstrate that they have background knowledge on health disparities of the, technology that they are developing, right? Because we've seen examples of where sort of not having that background knowledge at the outset sort of has cascading effects, later on. So I think the earlier that you can sort of build in some of these accountability practices, if you will, the better downstream the sort of product will, and the more the better downstream the product will be, and the sort of more robust this sort of overall ecosystem of accountability will be, I guess, right? So it sort of starts from many places. So if we start just with the company, and are they a company that sort of demonstrated that they understand the sort of wider world outside of the one particular condition, and some of these social determinants of health that people in public health are so familiar with, then we can also include things like, is the data representative, and not just in terms of racial and ethnic, but some of these more invisible, implicit ways that we see bias creeping in. So just to kind of quickly sum up, I think there's ways to, if FDA's kind of regulation can be more robust, to include some things like good machine learning practices, sort of centering equity, if you will. I think that can be a way to hold app developers accountable if they are wanting to have their apps certified by the FDA, and then if that policy itself is comprehensive, is robust, sort of bringing some of those attention to those issues at multiple places in that policy, then I think you can kind of get to a place where we can see a little bit more accountability for those app developers.
Thank you all.
Yeah, thank you all. This has been an unbelievable panel, and thank you very much. I think we could have gone on for another hour or two, but alas, we can't. So thank you all. This has been terrific. We are a little bit behind. We're going to take the 10-minute break at this point and come back at about 3:13 Eastern time. Try to start right on time then. And we're scheduled to finish at 4:15. We'll run a little bit over that to give the next panel a little bit of extra time. But thank you all. Let's take a few-minute break and see you back in 10 minutes.